Hello, and welcome to our BayCare Clinic live stream. We're at Orthopedics and Sports Medicine BayCare Clinic in Manitowoc to get some assurances regarding scheduling and undergoing surgery amid the COVID-19 pandemic. Thank you for joining us. With us today is Dr. Carl A. DiRaimondo. Thank you for joining us.
Nice to be here.
He's our guide today. He's board certified by the American Board of Orthopedic Surgery, and you'll hear from him on why you need not worry about making and keeping your surgical appointments even during this ongoing pandemic. This is an open conversation, so we invite you to post your questions and share any concerns that you might have. Dr. DiRaimondo will do his best to answer those questions in real time. If we don't get to your questions during the live stream, don't worry about it. We'll provide those answers when the live stream concludes. Before we get started, as you can see, we're doing our best to take precautions here and follow some social distancing and masking guidelines for our conversation today. So I want to assure everyone that we are being safe. With that said, let's sort of get right into the conversation. Doctor, we're experiencing an ongoing pandemic, the likes of many of us have never seen. Why should any of us even consider having surgery during these times?
Well, I mean, if everyone's been following this since early March, for example, and we realized when there was this huge influx of cases, and we all saw this on the news, and we in the healthcare profession, you name it, all areas of life, we didn't really know how to handle it. And so the initial reaction was, we need to preserve our resources, preserve, our staffing in the healthcare profession, and really care for these people that, we didn't know in our community or other communities if it was going to be another New York City.
Right.
So things like elective surgery, we can elect to do the surgery, we can elect not to do the surgery. We were told to kind of shut that down. I mean, literally March 15th had a meeting where we talked about the potential of this. March 16th, we did surgery. March 17th, we shut it down. Because at that time, we were so concerned about the possibility of us locally, but we could see it nationally. Unfortunately, elective surgery doesn't mean people don't eventually need it. And
right.
In our profession, orthopedic surgery, it's not so much life and death, but it's form and function.
Right.
And we had people out there that were already on the schedule that had gone through all the appropriate conservative treatment to manage, say, an arthritic joint, a torn tendon, and it failed. So they were pretty uncomfortable. Their quality of life was impaired by this.
Sure.
But based on the needs at the time for staffing, based on the needs for protective equipment, and just not knowing if we'd have a safe hospital environment, we weren't sure at the time, we shut that down. Now, good news, a lot has been learned, though one would argue there's still a lot to learn, but certainly
absolutely.
we learned a lot.
Mm-hmm.
And those same patients, though, that were waiting, their conditions weren't necessarily getting any better. They were getting worse. And we ultimately knew that once we had enough knowledge to understand at least how to manage or mitigate, is the term everyone's heard, the condition, it was time to get back to those patients. And we had several that during that time went from what we would consider to be elective to more of an urgent situation. So we were still doing emergent or urgent cases, but doing them cautiously. But now we've reached a point where we feel it's safe and have been doing elective surgeries for patients over the last several weeks.
Okay. Even so, there still seems to be this thought that many patients are still reluctant to schedule and undergo surgery during a pandemic. A, is there truth to that? B, how do you turn that around?
So understand this, and I've said this to friends and family and patients. I mean, if you're talking about where's the safest location, short of being in your own home with the people you know and have been sheltered with,
right.
Where's the safest place to be? It's probably a hospital who are doing the things that we all are doing and following CDC guidelines, where everybody wears masks.
Mm-hmm.
We maintain social distancing. Where they're doing cleaning and cleansing of the place. There's screening of every patient to come in, so they're asking questions about their health history and temperature checks and the like. So all that wasn't in place back in March, but is in place now.
Sure.
Also, the big thing that's allowed us to really get back and do surgery is testing. And in our market, we have on-site testing that can be done. Every patient prior to going through a procedure gets tested, so that at the best we can, because nothing is 100% guaranteed, but the best we can, we make sure the patients are safe, we make sure the facility is safe, we make sure we have all the appropriate equipment, So that at this point, I'm very comfortable, and as a physician, we take an oath not to do harm.
Right.
As we become physicians, I feel very comfortable that we're providing an environment for those patients who have a condition for us where they feel they can no longer live with it or sustain it, that we can provide them a very safe environment for care.
Right. So I think anybody who's watched any iota of news at all these past few months knows about masking, hand washing, so on and so forth. We know what we're supposed to do. But even so, I think there are people out there who are still concerned about coming to a healthcare organization, a clinic, hospital, whatever. What are you doing? What are you saying to patients to help counter those fears?
Well, it's just, as I've reiterated, we ensure the patient that we're taking all the known precautions that we can.
Mm-hmm.
We stagger visits in the office so they're not lingering in our lobbies. We get them in and through and out with minimal interaction with other staff other than essential staff. We're all universally masking. We're all taking precautions as far as cleaning and cleansing ourselves, but also rooms. Mm-hmm. You know, the good news, when we're doing all that, the vast majority of patients that were out there waiting and holding back are now starting to re-enter in the medical. You know, we're not going to convince everybody, and understand right. there's no way any of us can say there's 100% protection or guarantee.
Right.
But by applying all the recommendations that we have in the local level, the state level, the county, the federal, I mean, including the CDC, I think we're doing as good a job as we can to provide that environment. Because the concern is, if a patient waits on a condition, you know, the concern is what will their outcome be, you know, if they wait too long. And right. That's always the hard part. You know, right. That's the hard part for a patient. They're concerned on one end, but can they live with their pain or their dysfunction? How long can they put up with it?
Right. So do you think this will be the new normal, even if we flatten or totally squash the curve? Is this just the new normal?
You know, everyone's, you know, watching the news, and as the country's reopened and things have occurred, you're seeing an increased number. Now, some we can attribute to testing, but some of that's an actual increased number as people are out and interacting again, and maybe not following the same strict standards that we are in the healthcare profession.
Right.
So you know, I would say for the unforeseen future, because for now I don't think we're going to change anything because we have at least what we feel to be a very safe environment, until the day comes that potentially there are better treatments or certainly a vaccine,
sure.
where this doesn't become as big a concern. We may see a trend, but I think we're always going to think differently. We've all learned that we can't ever let our guard down again like we did before. I don't think it may be permanent masking and things like that if
sure.
we have those treatments, but at least for the interim, it's going to be this way.
Okay,
yes.
All right. Well, excellent information, Doctor. For those of you just joining us, we're here at Orthopedics and Sports Medicine BayCare Clinic in Manitowoc to get some assurances regarding scheduling and undergoing surgery amid the COVID-19 pandemic. Dr. Carl A. DiRaimondo is our guide today. He's explaining why you need not worry about making and keeping your surgical appointments even during this pandemic. Doctor, off camera we were kind of talking a little bit about life right at the point where we said, okay, we're going to shut down surgeries for a little bit, and then how that reopening took place. Do you want to kind of touch on some of the high points of that conversation?
Well, you know, as I mentioned already, we shut it down in a day or two. I mean, that's how quickly we shut it down. We restarted very gradually. I mean, and this, even though we've restarted, there's always an ongoing review of everything to make sure it's still safe.
Right.
And when we first started back, it was at half the volume. We had, you know, restricted schedules and interaction. We ensured once again that the staff in the hospitals were safe, the patients were safe, the equipment was available, there were beds available for patients. We've been gradually ramping that up. Every couple of weeks we've been ramping it up to the point now that we're near almost a full schedule.
Okay.
But it's still monitored every single day, every week. You know, the world around us and the community around us changes. If we were to see all of a sudden an increase in patients requiring hospitalization,
right.
utilization of the protective equipment, we may have to ramp back again. But the good news, we have that capability if necessary. So we shut it off fast, but we've come back very gradually to ensure that, once again, we want everyone to be safe if we're doing this.
Sure. Let's kind of switch gears for a little bit. Why is it important for anyone requiring surgery not to delay scheduling a procedure, even amid a pandemic?
Well, as I said, I mean, you know, our business is not so much life and death, and certainly there are some specialties where people have been putting off their heart surgeries and otherwise.
Right.
But that doesn't mean when someone has an arthritic knee, an arthritic hip, or a torn tendon maybe in their shoulder, time does have a bearing on how well they may do. And the longer you wait, the problem may become worse. The condition or the surgery may become more technically challenging. As someone has been more sedentary, partly because of sheltering, but maybe because of limits in their ability to do things because of their ailment, they become less healthy. So, our business, good news is mostly it's quality of life, it's restoring form, restoring function, but that has a vital role on physical and psychological health. And we want to make sure that it's safe to wait in some instances, but there are times where that threshold is met, that it's time to fix it before it becomes a worse problem where the outcome may not be as good.
Right. Let's delve into that just a little bit. I mean, what are examples of some orthopedic conditions that often require surgery, and what can happen in some of these examples if you just keep putting that off for fears of COVID?
Well, and some of the things that we initially labeled elective, but they became more urgent. Some of them might have fallen and torn the big tendon in the shoulder called the rotator cuff, and if that tear remains weeks or months, it becomes more stiff and we have a harder time repairing it. I had many patients with arthritis of their knee, arthritis of their hip, and they were already at the point where they were described end the stage. They did all the right conservative treatment, it didn't work, they were already pretty miserable. The problem is that joint continues to deteriorate. You start to become worse, you start to have more conditions. And those are some of the patients that ultimately ended up going ahead and having surgery, even during the time where we were very restrictive. Someone has a knee injury playing a sport, tears a cartilage, tears a ligament. To some degree we can wait, but if there's a tear that needs to be repaired and you wait too long, the repair may not be as successful. And so those are things that we have to gauge, and we had to educate our patients. It's okay or not okay to wait for something like that.
Right. Well, what do you say to those who, even after hearing all the safety procedures and protocols and standards that we employ, they're just still reluctant about scheduling and even more so undergoing surgery during this pandemic? What do you say to those folks?
All I can tell them is this, that we in the healthcare profession are trying to follow the highest standards that we have available to us in safety, screening of patients. None of us can tell a patient there's still not some slight risk, because that's the nature of a respiratory virus. Influenza, coronavirus, they're out there.
Right.
I would just counsel them that if they have a condition that they can live with it and they're still functioning, then they're probably fine, and continue to wait and get it done at a later date. If that condition is deteriorating, it's affecting their function, it's affecting their quality of life, they're requiring medications to manage pain that have their own side effects, that's not the right way to handle it either, because it is safe enough to come in and have us at least assess, talk. You can either meet with us personally, face to face, or we can even discuss this via a telehealth visit where we can do a video visit, so it's those that are more reluctant to still enter into a clinic, we at least have that ability to communicate, discuss, and help them understand their condition and whether they can wait longer or whether it's time to make steps or go through the steps to get their surgery completed.
Right. I'm glad you mentioned telehealth. I was hoping to kind of delve into that very briefly. That sounds like that's been a valuable tool during this pandemic.
Well, I mean, if you're looking for positives that came from something like this, the advancement in the telehealth of the video visits because of the need, the loosening of regulations to allow us to do it, the explosion of Zoom and other platforms we're all familiar with now. But that'll be a tool that we'll always have going forward. We're using it probably more now than maybe we'll use over the long term, but we'll always use it. In our field, it's important for us to, at some point, we got to lay hands and do an exam. But that doesn't mean we can't do as much through the telehealth type of platform, so we can once again minimize the encounters where someone has to come into the community or into the healthcare environment.
Okay. Do you have any last thoughts? Anything we didn't touch on that you'd like to share? Well,
as I said, we've worked through, in a very deliberate way, bringing back elective surgeries in all the specialties, but specifically in orthopedic surgery. As I tell others, I'm very comfortable going into a hospital environment or a clinic environment. And I have got the same concerns that everyone out in the public has. Their personal health, their family's health, their loved one's health, parents and otherwise. As I say, I feel as safe in the hospital or the clinic environment as I would feel anywhere else. Having said all that, I think it's important for the individual out there that has an ailment, that they're concerned about, that they might still be reluctant, at least reach out and communicate with their physician through some platform to discuss, once again, how acute versus chronic versus delay versus move forward. But realize we've put together, I think, a process that can be very safe, and it has been safe. We've been doing this now for almost
A little
6
bit.
weeks, where we've kind of ramped back up to where we can do elective surgeries for our patients.
Yeah, all right. Thank you, Dr. DiRaimondo. Thank you for your time and your insights.
My pleasure.
Well, thanks everyone for watching. That pretty much concludes our live stream. We'll continue to answer any questions online after this live stream concludes. If you do want to learn more about how Orthopedics and Sports Medicine BayCare Clinic in Manitowoc is keeping patients safe amid the COVID pandemic, you can visit us by clicking on the link in the post below, or call Orthopedics and Sports Medicine BayCare Clinic at 877-618-6676. Thanks for joining us, and enjoy the rest of your day.